This week on HealthBreak, Dr. Christopher Porterfield, an electrophysiologist at French Hospital Medical Center, talks about the Watchman device, which can be life-saving for people with atrial fibrillation.
It's important for people to understand, one, that they're at risk for stroke with atrial fibrillation. They also need to know that they have an alternative to blood thinner, and they don't have to take it, especially if they're contraindicated with either bleeding or falling.
Watch HealthBreak on the Central Coast CW at 10 p.m. on Mondays, Wednesdays, and Fridays.
HealthBreak is sponsored by Dignity Health Central Coast.
Atrial fibrillation is the most common heart arrhythmia in the United States. Dr. Christopher Porterfield at French Hospital Medical Center explains.
Atrial fibrillation is an irregular rhythm that is typically generated from the left atrium, and it's a very rapid, irregular heartbeat that predisposes people to stroke.
The left atrial appendage is a pouch in the heart where atrial fibrillation can cause blood to pool and clot. That clot can then be pumped out of the heart and block blood from getting to the brain, causing a stroke.
Typically, patients are placed on anticoagulants, blood thinners that thin the blood to prevent stroke. For people who don't want to be on blood thinners, we can place a small device in the left atrial appendage and seal off that chamber to prevent stroke.
That small device is called the Watchman.
The Watchman device is implanted through the leg. We place an IV in the leg that then goes up into the heart. We cross from the right atrium to the left atrium and then place this device in the left atrial appendage. It takes anywhere from 4 to 6 weeks for this to seal off, and then patients would go off their anticoagulant. The biggest thing is for patients who've had a history of major bleeding who cannot take a blood thinner, being able to have an option to reduce their risk of stroke and not bleed, it's a lifesaver.
For more information, visit dignityhealth.org/Central Coast.
HealthBreak was sponsored by Dignity Health Central Coast.